I'm now at Biophore with a double act of Gautam and Kalyan. Is that right? Kalyan. Kalyan, I'm so sorry I got your name right in the end. So tell me, gentlemen, what does Biophore actually do?
We are API manufacturer. We are based in Hyderabad. We have two facilities in Visakhapatnam. Both are US FDA approved. And we have some European accreditations also.
Let me just go backwards here. So you're API manufacturers, but these are generics we're talking about.
We are mainly into the generics market, and the APIs that we concentrate are mostly then very, very niche molecules. They involve a lot of complex chemistry involved. We, concentrate on many novel we develop a lot of novel polymorphs through novel processes, and we have almost 50 patents to our name.
Wow, that's incredible. And actually, I was just looking at the number of drugs behind you on the boards behind you. I mean, they really are across an entire spectrum of disease, aren't they?
Right. The major segment is the oncology and the contrast media. We have a line of products covered in the injectable dosage forms, and we have around 51 products in the injectables. We have very stringent controls on the microbial the limits and all. So we do a lot of research on that to control the impurities, and also most of the products are of the purest grade. The impurity profiles are well under control. They comply with the ICH, and sometimes they exceed the expectations of the ICH.
Well, I was just going to say, I was last in Hyderabad 20 years ago, and Hyderabad that I remember was incredibly poor, very, very little infrastructure. It's changed tremendously in that time, hasn't it?
It is a radical change that you will observe, actually. It is now the IT hub of India. It is the pharma hub of India. Almost the top top 10 players are there in Hyderabad today. Say Dr. Reddy's, Mylan, I'm sorry, it's not Mylan, Hetero, MSN, everyone is there in Hyderabad today. It is now growing rapidly. Yes.
And also, I suppose that leads on to my next question, which is, you say you're FDA approved, which is obviously we're crucial for the US market. But again, quality control has always been something that's plagued India. And I get the sense that the pharmaceutical industry has changed and is cleaning up its act.
Coming to the quality, we have a very strict control on this. We have a very experienced quality control department, and we are proud to say that the last two inspections in our manufacturing facilities came out with 0480. This means no observations, zero observations from the FDA. So we cleared it out for the second time. The last inspection was in September of 2016.
And how often does the FDA actually come and inspect? Is it yearly now?
It's not yearly. It's 2 years. Yeah, 2 years. And within that 2 years, if you have filed a product and say the product has been reviewed and it is waiting for the approvals by the FDA, then they might come in, they might inspect your plant. But it's generally 2 years, 2.5 years.
I think the most extraordinary thing is if you look at the cost of, I'm a physician actually, I'm a medical doctor, so if you look at the cost of healthcare globally, it's spiraling, drug costs are spiraling. The United States spends 10 times per capita what we do in the United Kingdom on health, and they're all desperately trying to slash their pharmaceutical costs. And so generics is incredibly important, and you're incredibly well placed for that, aren't you?
Yes. The APIs which we manufacture are not only just of the high quality. They are the processes which we do. So we achieve the product at a very low price. So very low price, we do not compromise on the quality as well, because that is the first thing which not only on the US but global in the global arena, the quality is a must, because a tablet which is working good in US should also work good in this one. So
we add on to this,
one quality and one world. That's our motto.
Quite right. Oh, that's a brilliant phrase actually. One quality, one world.
Right. I would like to add on to this, because we are in India, but to add to your surprise, we don't sell anything in India because they expect at a very low price, right? And the quality that we give is almost equivalent to the US, even Japan. The most stringent specifications that are available in this world, our products comply to that. But then our directors nowadays, they have taken a decision to support the Indian markets as well with the same quality without compromising on that.
Which is vital.
Yes, because we are in India now, we need to do something for our country as well. So there are instances in the recent past wherein we have supplied the products at no profits to us, but we didn't compromise on the quality and the price.
Well, obviously, you're both very young men. How do you see the future for India? Because, I said 20 years ago when I was here, it was a very different scenario. In 10 years from now, how is India going to be playing on a global playing field?
If you observe the DMF filings, the top 10 companies have at least minimum of 8 companies from India. So our company is also in the one of the top, in the top 10. We started the company in 2007, started filing DMFs in 2010. Now till 2016 third quarter, September 30th. We filed around 10 DMFs, and we are in the top 10 filers of the DMFs in the US. And the top 10 companies, list of companies, have more than 80% companies based in India.
I mean, that is extraordinary. So the future for India is very bright.
Very bright, because you can take a Dr. Reddy's, it is an pharmaceutical hub. We have got many companies, lot of research going on the generics front, both on the API and the formulations. So we see India as to be the most strongest pharmaceutical hub in the world.
Well, gentlemen, I wish you the great deal of success going forward, and thank you very much for our chat. Thank you.